I would like to take this opportunity to welcome you to your forum. My name is Dan Mote. I'm the president of the National Academy of Engineering, and I've been honored to give you 5 minutes worth of welcome to the academies, and it's my extreme pleasure to do this. Of course, I will punch up a little bit of National Academy of Engineering as well, since it's an important part of these global partnerships issue. In fact, the engineers essentially build their whole communities and careers on partnerships, as a matter of fact. But I thought I would tie this a little bit to the grand challenges which you have heard about. And in fact, there are now grand challenges for medicine, and the NAM is working on its grand challenge for healthy longevity. The 14 grand challenges for engineering from 2008 really are goals to be satisfied by a vision statement. So you start off with a vision statement, and then of course you end up with the goals required to be satisfied to reach that vision. And the vision statement for the grand challenges is continuation of life on the planet, making our world more sustainable, secure, healthy, and joyful. So that's a very bold statement for many reasons. First of all, it's a planetary statement. There's never been a planetary vision for engineering in the world that I can remember or have ever heard about. Maybe that's not true for medicine. Maybe you have planetary visions for medicine. But the questions, concerns, and issues of human health basically are touched on by all 14 goals or 14 grand challenges for engineering. But 3 of them are directly addressed by the grand challenges. One of them is engineering better medicines. This is from 2008, by the way. It asks how engineering can be used to personalize medicines, allowing for patient-specific diagnosis, treatment, and monitoring of healthcare decisions. Another one is reverse engineering the brain. This is from 2008, 5 years before the Obama initiative on the brain. It seeks to learn how the brain works and to understand the brain itself, as well as advance artificial intelligence decision-making. Understanding the brain's processes, could enable engineering to better simulate its decisions, leading to deeper insights about how and why the brain works or doesn't. The third one is advanced health informatics. This calls on engineering to introduce the collecting, tracking, and analyzing of data in health information systems to create new methods for treating patients and to inform health agencies about impending public health emergencies. So creating successful and sustainable global health outcomes requires collaborations, as the world today operates on collaborations and partnerships. Global health challenges, like the grand challenges for engineering, are diverse, multidisciplinary problems, often having multiple determinants that affect many people and sectors and require actions by different sectors. Sector collaborations bring together talents and experiences, thereby enhancing the strengths, perspectives, and resources of the collaboration. This diversity, along with the commitment to work together, leads to the development of the creative and multidisciplinary solutions required to tackle system challenges. Collaboration leads to partnerships that assemble the expert talents and facilities needed to accelerate desired outcomes. That's the model of the 21st century for engineering, by the way. Multi-sector collaborations is necessary to achieve the global vision laid out for the grand challenges. Your discussions here today will illuminate the thinking and know-how behind development and sustainability of global partnerships and collaborations. 2, the National Academies of Sciences, Engineering, and Medicine provide independent, objective advice on public policy decisions. The academies are great conveners, bringing together experts and practitioners across all related to science, engineering, and medicine, and their implications for policy and practice broadly. 4 years ago, the Academy's Forum on Public-Private Partnerships for Global Health and Safety held its inaugural meeting, during which I spoke, actually, about the forum objectives for open dialogue on complex and diverse topics relevant to the growing role of the private sector in contributing to diverse global health initiatives. Now, this forum, as I understand it, seeks to foster collaboration, a collaborative community of multi-sectoral health and safety leaders from multinational companies, governments, foundations, humanitarian and professional organizations, academia, and civil society, more or less everybody, to leverage their strengths and knowledge to benefit global health and safety. You have my very best wishes for the success of this adventure, and I am confident that the grand challenges for engineering also will continue to be a player important in global health and safety.